Hi, Dr. Sywick here, one of the physicians at the Pain Center of Arizona. I'd like to take a few minutes today to tell you about TPC spine lift. This is a minimally invasive solution for patients that have a condition known as lumbar spinal stenosis. So what's lumbar spinal stenosis? Simply put, it's a narrowing of the canal where the spinal cord and the spinal nerve roots run. This canal can be narrowed. It can become stenotic. There are several factors that can be the cause of this. Sometimes it's inflammation of a disc. Sometimes it's inflammation of the joints around that canal. Sometimes it's because of a ligament in there that gets thickened. In any event, what ends up happening is that narrowing will cause this stenosis, and that will reflect in patients having back pain. Back pain often shooting down their legs with prolonged standing, prolonged walking, sometimes simply bending over can relieve some of that symptoms of that sharp shooting pain. Today I'm going to tell you a little bit about TPC spine lift. We utilize the Vertiflex procedure for this. Oftentimes what happens with this spinal stenosis is the lumbar vertebrae here, as noticed by these kind of off-white vertebrae bones, and these blue discs, those are the spongy shock absorbers, if you will. When those narrow, when those bulge, that space gets really tight. If you look at the back here then of the spine, these are known as the spinous processes. With the Vertiflex procedure, we can go in and simply lift up that space. Notice, if you will, on the side here, this is where the spinal nerve roots come out. Imagine, if you will, when these discs get worn down, these holes here where the spinal nerve roots come out, they get really constricted, further adding to the spinal stenosis. That can occur in the middle centrally, or it can occur out toward the foramen, the holes where the nerve roots come out. The Vertiflex procedure is simply a way under live x-ray guidance with a small Band-Aid procedure, and frankly a procedure that takes us less than 20 minutes all in all, outpatient-based procedure. We can go in and place a small device where we spread out the opening here and take pressure off the canal centrally, take pressure off the nerve roots coming out, relieving that stenosis. So that's TPC spine lift, a minimally invasive solution for patients with spinal stenosis, an outpatient procedure, less than 20 minutes, and you're pain-free.